Hi, this is Carla with Yoga Events Sacramento, here to bring you part two of my Breathing Easy series, pelvic floor and simple exhale breathing. So I hope that you watched my introduction, which gives a few um, clues and advices to what breath work is, a little bit about the basics, mainly how to be present and notice your breath. So we'll be using that for this little breath work exercises that we're doing as well. So finding a comfortable seat or standing. You could lay down, it's not as ideal, but what works for you is what you'll need to do. So maybe getting some wiggles out, shoulder rolls, you can do some neck rolls. Getting grounded in your seat or with your feet at the same time, getting the spine nice and long. Crown of the head is going to be pointed to the ceiling, so you'll have a slightly tucked chin. And then bringing your attention to your surroundings right now. Maybe listening to the furthest away sound, and then bringing your attention a little bit closer to the space that you're in, acknowledging any noises, acknowledging where you're sitting or standing, maybe bending one knee and then the other, growing tall again in the spine, and then bringing your focus, if it's comfortable, inward to your breath. You're not controlling it, just noticing. Maybe you notice the air is cool as it enters your mouth or your nostrils, and then warmer as you exhale. Maybe you notice you breathe more from your chest than your abdomen. It's all fine. We're just noticing. And then raising your awareness a little bit, we are going to do an exhale focused breath. So continuing to breathe, not holding your breath. Instead of inhale, exhale, we're going to start out with an exhale and then fill up. Exhaling being the focus, because it's only when we exhale all the waste out of our lungs, out of our bodies, that we can inhale the fresh oxygen that we need for our blood and for our bodies to continue. So just doing 5 breaths like that. One more. Exhale, inhale. And then maybe do some little movements. You finished that one exercise. Hopefully that was something good. Now we're going to do this pelvic floor breathing. So our pelvic floor is what supports our organs. And then above those organs, of course, is our lungs. And in between is the diaphragm, which is a upside down bowl shaped sheet of muscle. And so naturally, when we inhale, our diaphragm drops and we expand, the lungs fill up. Exhale, the diaphragm contracts. We expel that stale air. But also when we inhale, the diaphragm drops. It relaxes our pelvic floor muscles, which are frequently tight and the cause of pain and urinary issues sometimes. And then exhaling, when that squeezing of the diaphragm pushes out the stale air in the lungs, that's when there's a little bit of strengthening. So just with breathing, we're relaxing and strengthening our pelvic floor. So it's a little bit deeper of an internal focus than just focusing on our breathing. So starting out with a focus on your breath, then see if you can notice the subtle dropping of the diaphragm as you inhale, expand the belly and the lungs from the bottom up. And then see if you can notice the squeezing or contracting of the diaphragm as you exhale. We'll just do this for 5 breaths. Last one. And then going back to your normal breath, maybe diving inside, noticing if there's any shift in your focus and how you feel, in your nerves or lack of nervous energy. Well, thank you for joining me. And I look forward to part 3 in another week or so. In the meantime, breathe easy, walk in peace, and be kind to each other. Namaste.